Hi, welcome back to my channel, and today we are going to talk about ejaculation in diabetes. If you suffer from diabetes and you have sexual function issues, especially related to ejaculation, this video will help you to understand where the root of the problem might come from, how to deal with it, and how to prevent it. Also, I would recommend to watch this video in combination with ejaculation process video in normal circumstances that I posted before it. It will help you to compare the difference between ejaculation process in normal circumstances and ejaculation process in diabetes. Let's begin. In this presentation, we're going to look at the process of ejaculation in diabetes, how different stages of ejaculation can be affected by diabetes. It's important to understand that diabetes, both type 1 and type 2, can disrupt the ejaculation process at different stages because of the impact on nerves, blood vessels, and hormones. So let's look at each stage in details. The first condition for the ejaculation to happen is to have strong and lasting erection. And strong and lasting erection can only be possible if signals of sexual arousal and sexual stimulation are received from the brain. What happens there is that brain receives sexual stimuli from the outside world, processes them, and then sends signals through spinal cord to penis that sexual activity is about to happen, get ready for erection. If a person has diabetes, it means that there is a chronic high blood pressure damage to peripheral nerves, and that can make the communication between brain and penis is very difficult. And therefore, erection might not happen in the same way as it should in normal circumstances. So, if nervous system is damaged due to diabetes, then quite often it can cause erectile dysfunction. And erectile dysfunction obviously cannot provide ejaculation. Or if penis is not able to maintain erection for a long enough period of time, it's very difficult for ejaculation to happen. Another problem is that during diabetes, blood vessels can be damaged. And for erection to happen, the presence of healthy, functioning, clean arteries is important. And remember that cardiovascular system and male reproductive system, they're very much connected. And if suddenly, out of the blue, man starts to experience problems with erection, it's important to go and do medical checkup to eliminate any heart-related or cardiovascular-related issues, because what's happening to heart can be felt by reproductive system much earlier than it's diagnosed, basically. So if there are problems with erections, it's important to check general health and especially cardiovascular system. So if blood cannot go to penis easily and in that amount as it should in order to create erection and in order to maintain it throughout the whole process of sexual activity, it will be impossible to have ejaculation. Another very important factor is obviously the testosterone level. Testosterone is very important for sexual arousal and sexual drive, because if the level of testosterone, male hormone, is low, it can impact male libido, male sexual drive, and male general health and longevity. And of course, if obviously libido is impacted, there is no erection, or erection is very weak, and that makes ejaculation process impossible. So the conclusion to that, without proper erection, ejaculation will be difficult. So if you suffer from problems with ejaculation and you have diabetes, it's important to check how your penis gets aroused, how strong your erections are, because that could be one of the causes why there are problems with ejaculation. The next stage of ejaculatory process is called emission phase. Emission phase is when sympathetic system gets involved and all the muscles, smooth muscles, we're talking about muscles that we cannot control voluntarily, they get very strong contractions. And here in the picture you can see the organs that belong to male sexual system, so muscles that take part in ejaculatory control and in this process. And we talk here about epididymis. This is where sperm is stored, matures and stored, and then muscles of vas deferens. This is the cord through which the sperm is transported throughout the whole male sexual system. Then seminal vesicles, where it picks up part of the seminal fluid. Then it goes through ejaculatory ducts towards prostate, where it picks up the rest of the seminal fluid, then a little bit of corpus gland fluid, and then it's exported throughout the urethral sphincter from the body. And that's how ejaculation happens. And during this process, in order to prevent sperm from going into bladder neck closes up. And that's what happens in normal circumstances. So if man suffers from diabetes, that's what unfortunately happens. So on this picture, it shows that in normal circumstances, sperm goes through prostate and all those processes, and basically goes out through urethral sphincter outside. It doesn't go into bladder, it doesn't kind of touch this opening. But when diabetes, unfortunately, the bladder neck cannot open because of the damage of internal urethral sphincter, and it causes retrograde ejaculation. So ejaculation, instead of going outside, goes inside bladder, and it causes a lot of pain actually. So quite often the symptoms of retrograde ejaculation is when urine becomes quite cloudy because it contains ejaculate there, and also there is a reduced semen volume. So especially it's bad if people try to get pregnant and to conceive. There is more likely it's not gonna be successful. Another problem that diabetes can cause because of this nerve damage is called delayed ejaculation or anorgasmia, and that happens because again nerves are damaged because of the blood sugar level, constant chronic blood sugar level, and it impairs nerves that are responsible for coordinating the release of sperm and seminal fluid. So that will obviously delay ejaculation, and that can also cause lack of orgasm, absence of orgasm because of that. The third stage of ejaculatory process is called expulsion phase. That's when muscles that we can voluntarily control get involved. And in this case, we have ischiocavernosus muscle, as you can see on the picture, and bulbospongiosus or bulbocavernosus muscles. These are pelvic floor muscles that are located at the base of penis, and their role in the process of ejaculation is very important, because with their help, ejaculation process becomes possible and strong, and in addition to that, the sensation, the contractions of these muscles, they add very pleasant sensations to the whole process. Unfortunately, during diabetes, what happens here? Because these muscles are weakened, and that's why they cannot provide quite strong rhythmic contractions that propel semen, and that can lead to very weak ejaculatory force. And instead of basically having like a forceful release of sperm, men might experience some kind of dribbling. So if this is the case, it's important to look at your pelvic floor muscles control. And in my program, Erection Fitness, we train these muscles specifically in order to maintain the strength of pelvic floor muscles that are responsible for the whole sexual process and sexual well-being of men. Another thing that can cause problems during diabetes is called painful ejaculation, when man experiences pain while ejaculating, and that happens because of infections or inflammations in the reproductive organs, and it is more typical for diabetic men because of the weakened immune system. So it's very important to obviously check with the doctor to eliminate any infections, any inflammation processes, because that can obviously destroy the pleasure of sexual activity and also create more psychological problems like anxiety or avoidance of sexual activity. The last stage of ejaculatory process is called resolution or refractory stage, and that's when penis after ejaculation goes to its flaccid state. And the period between when penis will be again ready for sexual activity depends on each individual man. There is no like a set time how long penis has to rest until he's ready again for the action. It depends on individual factors, on the level of health, and of course age. Men who have diabetes would have quite prolonged refractory period, and that's due to hormonal imbalances, especially related to low testosterone level. So it's quite important to take it into consideration. If you have diabetes and you struggle with ejaculation, there are a few additional factors that are important to take into account. So, first of all, your psychological, mental health, because this can have a very strong impact on your sexual activity, your sexual performance, and of course the ejaculatory process. Anxiety, depression, negative emotions affect self-esteem, and that can interfere with sexual performance and of course ejaculatory processes. Medications. What type of medications are you currently taking? Because some diabetes medications, especially for hypertension, can have side effects on ejaculation. So it's important to check side effects of those medications that are currently in your use. And Of course, it's important to test the testosterone level, because it is quite common that men who have diabetes, they might have low testosterone level, and that can impact the libido and sexual drive. That can obviously have negative effect on erection, on the endurance during sexual activity, and therefore ejaculatory processes. Having diabetes is not great, however, it's not the end of the world, and with the right management of your health, you can still have fulfilling, satisfactory sex life. The first condition is obviously to have a glycemic control, to manage blood sugar levels under medical supervision, and it's very important in order to prevent or slow down the progression of neuropathy or vascular complications. Secondly, it's important to obviously consult with medical professional, and I'm not really up for medications when it comes to sexual health, but in the cases of diabetes, I would recommend to do a proper checkup, and if any other alternatives ways that I'm gonna talk about in a minute won't help to manage your erections, to manage your ejaculatory control, to have satisfactory sex life, then I would recommend to ask advice from medical professionals like urologists and endocrinologists. However, it shouldn't be your first point of contact, because like I said, it should be the last resort. After your glycemic control, it should be the last resort. I would highly recommend to get sex therapy support, because sex therapy is specifically dealing with sexual function issues. It's a goal-oriented, targeted type of therapy, and you will learn a lot of tools how to manage anxiety, stress, negative emotions that have enormous impact on your sexual health and well-being. And of course, throughout this presentation, you probably noticed that pelvic floor play essential role in sexual well-being and sexual processes. And I would highly recommend to do erection fitness. That is not just an app where you bluntly do exercises. This is an education where you learn a lot about your pelvic floor muscles, and you have a lot of education, more than many doctors do. If you found this video educational and informational, please don't forget to hit like. Please also subscribe to my channel for more education and information on sexual health and well-being. And if you have any comments or questions, please put them under this video. See you soon!